So this is a taping technique for medial knee pain, so pain coming from the inside of your knee. If you're experiencing pain in here, the chances are you may have damaged your medial meniscus, you may have sprained your MCL. Either way, this technique should help alleviate some of the pain you're experiencing. So what we need to do first is identify some bony landmarks so we know where to run the tape to. The first one we want to look at is we want to come onto the knee and then come down, and then you'll feel almost like an upside down triangle of bone. This is called the tibial plateau, and as we follow it down on the inside, you'll feel the bone goes inwards and then it hits the shaft of the tibia and it straightens out. So our first point we want to go from is just where that bone, where the angle of the bone comes in and then straightens down. So we're going to take from there, and then if we come up onto the top of the knee and onto the inside, you can feel the big bony nodule of the medial epicondyle of the femur, and we want to finish just superior to that. Okay, so you feel this large round protuberance here, and then just above that, that's where we're going to end. So I've pre-measured this with my bit of rock tape, so I've come from that angle around the knee, finishing just above the epicondyle of the femur, and then what I've done is I've cut it to size and then I've rounded off the edges. Round off the edges will help this tape stay on a little bit longer. What we do first, or second then, because we already measured, is we rip off the first inch of the backing and then peel that away. And being careful not to try not to touch the glue. We put the first piece of the tape down and smooth it on. From here, we keep 2 fingers on the piece we just attached and give a light tug on the tape. By giving a tug, it will lift the backing off. Then we lift the backing up, so we're holding the last inch, and then we're smoothing the tape on with little to no stretch at all. And then when we come to the end, we're just smoothing it down, no stretch at all. Then we take the backing we tore off with the printed side, we're just going to rub the tape down. The heat activated glue, so we activate the glue, hold the tape in place. Okay, I've then got 2 further strips. What I've done is I've measured it about the width of the tape we put on, plus 1 centimetre to 1.5 centimetres either side. Okay, so, and then what I've done again is round off the edges. With strip 1, what I'll do is we'll go with saying the pain's on the inside of the knee in here. So what we're going to do is we're going to rip this strip down the middle, and then we're going to pull it apart, and then the backing will come away and we grip it. So this is no stretch, this is 100%, and what we're trying to go for, that's about 50, is 75 to 100% stretch, and we're going to lay the tape over the site of the pain, like this. So we've laid it on with 75 to 100% stretch, and then these end bits, which are still attached to the backing, are smoothed down with no stretch at all. So all the stretch in the middle with no stretch at the end. Again, using the backing, rub it down. We take our 3rd strip, rip it in the exact same manner as we did number 2, straight down the middle, little pull apart to break the backing off, peel the backing back, again 100% down to 75 to 100, and then straight through the site of the pain again. And again at the end, no stretch. And then smooth that on. And then what we're left with is like a cross over the site of the pain. There it is, taping for medial knee pain.